Hi everyone, I'm Emerlinda Manalo, and today I'll have my lips and nose enhancement procedure. I have natural dark lips since for as long as I remember, and this is something I've personally wanted to improve to boost my confidence. And also today is my second session for nose enhancement. I think it's been a year since my first procedure, and up until now, the results still good. I choose CSA because of Dr. Contessa's skills. I've researched about other doctors and other clinics, but yung na-satisfy ako sa results ng mga procedures is yung mga gawa lang ni Dr. Contessa. Don't forget to click the subscribes and the notification bell to keep you posted.
Hello everyone! We are with Ems. Ma'am Ems, how are you?
I'm good, Doc.
Okay, so I'm checking at her nose and also checking at her lips and checking on the chin and the under chin, the center part of the face. Looking good, Ems, right? So we had a non-surgical nose enhancement one time.
Yes, Doc.
How long ago?
A year ago, Doc.
A year ago. And then for the lips, we had not done anything. For the chin, you had two sessions.
Yes.
Okay. And under chin,
None.
none. Okay. So for today, we'll be doing the booster for the nose. And then Ems has a concern.
Yes.
The lip area, the borders, kind of like pigmented.
Yes.
Right? And then the chin, still good, right? Remember, we had the hyaluronic filler. And we also want to work on the under chin to get rid of the so-called beginning signs of aging. Plus, kind of like when you bend your head, right?
Yes.
You notice a double chin, right?
Yes, Doc.
So for now, I'll start with the nose region, okay? And it's again the non-surgical approach. We'll be using polydioxanone threads. A while ago, there was a numbing cream that was left for about 30 to 45 minutes. Okay, then also I'll follow it up with the lip enhancement using our hyaluronic substance. And then the chin still okay. And the under chin will be using our PDO threads for the tightening and firming effect. So let me start with the nose. Okay, so we will be injecting our lidocaine at the entry point. Okay, inhale, exhale, Ems. You know the feeling, so yes, you have an idea of this. Yes. Then we'll make our puncture of our entry point, to followed by the so-called hydrodissection. We'll be using a cannula. Okay, let's use a cannula. So this is my cannula here with the tumescent anesthesia. So this is my technique for repeat non-surgical nose thread lift. I do a so-called hydrodissection to kind of open the space, create that tunnel for my polydioxanone threads. There you go. I'm already at the radix region. So this is a tumescent lidocaine. Just numb the area so Ems will not feel any pain at all. And then I'll start with the polydioxanone thread. Her nose is still good, right?
Yes, Doc.
Still elevated, good bridge, good projection. This is just the enhancement and the booster. Okay, we'll go with the radix. I notice you have a mini nose bump.
Yes, Doc.
Like you have this dorsal hump. Yeah. May lahi ka ba, Ems?
Wala, Doc.
Usually, that is amongst Caucasians that you notice there's a dorsal hump. So if individuals have that, the thing is they have a radix that's kind of concave. So we want to do the improvement of the radix, make it convex. Okay, so quite a bit, there's a resistance there. Okay, now we're done with the bridge. We'll now work with the tip columella. So there's a space there. Here is my introducer needle. I'll redirect it towards the columella space and use my anesthesia again to numb the area here, and I'll just direct it into that intercrural space up to the anterior nasal spine, and we'll be using short PDO threads here. Okay, then I'll pinch the columella, and then we'll be using just 2 pieces of this. Okay, sorry, Ems. We have to reach that anterior nasal spine. Okay, so we've done the booster nose thread lift. Now let's work with the lip area. Now, since there's a concern of a pigmentation on the lips, okay, so right now we have a hyaluronic filler that also contains vitamin B12, and this will help in depigmenting the lip region. Okay, so some sponge for the nose tip area. Wow, the nose is looking good. Okay, so I'll work on the lip area, and my technique will be a so-called needle method or needle technique. So I'll work on the so-called GK point first, just to have this so-called GK point come out, and then I'll be injecting into the vermilion border, so she still has that bleed from the nasal region. So this one for the lip border or the vermilion border. So it's color, the color is this red because of the vitamin B. You're good, Ems?
Yes.
Then I'll work on the lower part here, and then just giving a short linear method with the semi-fanning technique. Then after that, I'll follow it up with the lip border area, some short linear technique there. So I'll just also inject on the border, okay, on the border here. So as to the number of the ml that you're gonna give for the lip area, some individuals, they use like less than 1 ml only. Some individuals use 1 ml, and I had patients who use 2 ml. So it will just depend on the need, the volume. How much volume should we restore? And since Ems is just young, mid-20s, no, Ems?
Yes, no.
She's still very, very young and still single. No plans yet, right, Ems?
No.
Okay. So again, this is to help those individuals with concerns of dark lips or pigmented lips. So let me just transfer to the other side. So the lip area, when we work on it, it's expected to have some bleeds because it's a vascularized region. I'm just continue with this lip border here. I'm sorry, Ems. It's just this needle. I know the feeling. Try this on myself. When I tried it on myself, I only used like a 0.4 ml because I only want minimal improvement. So if you are a beginner or like a first time to do or first time to have this, you may want to start with minimal amount, so not too much. So this still has hyaluronic substance, and again it has a vitamin B. That's why it's color like this. And again, this is for the pigmenting. So we want to make the lip pinkish, Ems, or just reddish.
Yes,
okay, as much as possible, we want to have that nice color of the lips, healthy looking lips, volumized lips. And then we'll just finish up with the upper lip tubercle. So this is a needle method combined with short linears and some some semi-fanning technique or tenting technique. So this is called tenting technique. Some short linears or also called fencing technique. They call it fencing technique also, okay? So usually with this treatment, case-to-case basis, sometimes we tell them to come back after a month and we might do another booster dose for the lip, kind of like a correction of pigmented lips. Okay, so I'm done with the nose and the lips. I'm just gonna finish off with the under chin of M's to make it tight and firm. So we'll just numb it with our pain freeze spray. Okay, so we sprayed it with our pain freeze or the so-called cryo anesthesia. So I'll use my short polydioxanone. This is a screw type. It's a structurally modified type of polydioxanone. So you notice on the needle, the thread is kind of coiled. So it's kind of spiraled or twisted around the needle. And then I'm just gonna insert it subdermally. So this will help in tightening, firming the tissues under the chin. And this has a lipolytic effect around 24% fat reduction with this polydioxanone. So we'll just pull it out now, and then I'll just finish off with the other side. So this is a transverse pattern, like a step ladder pattern. You can also do the vertical approach, where your entry points would be on top or beneath the so-called chin apex, so we can still do the vertical approach. This is a mesh pattern and it's gonna further tighten the tissues there. So you can do like diagonal vector, vertical vector, transverse or lateral vector. So better to do the combination to have really that optimal result. Okay. So let me just pull that out. Let me do the other side. So we'll finish off with this one. So just direct it to the inferior part and then we'll finish off with 3 more strands here. And we're almost done. You're okay, Ems?
Yes, Doc.
Okay. So we've done combination procedures. Okay. Nose, lip enhancement, under chin tightening with PDO threads. Let's show the result when we return. And we are back. So let's show the result to Ma'am Ems. Ems, here's the mirror. Check the changes on your nose and the lips and
Dok,
under
ang
chin,
ganda.
right?
Yes,
so
Dok.
there's an instant result. So we've done the second kind of like a treatment of your nose.
Yes,
This is the
Dok.
repeat nose treatment. And for the lip, it's your first time.
Yes,
So
Dok.
we've used a combined hyaluronic with vitamin B to also target the pigmented areas on the lips, particularly the lip border.
Yes,
and then we use also those fine PDO screw type of threads to tighten and firm the under chin area.
Yes, Doc.
Right?
Doc,
How
ang
was the
ganda.
experience while we were doing it?
Actually, tolerable lahat
Yes.
po, Doc. May slight lang sa lips, pero after the first few inject po, it's very numb, Doc.
Numb already,
Yes,
right?
po.
Because it also has lidocaine with it.
Yes,
You know, the lip area, because it's sensitive. So
Yes,
when you
Doc.
have tiny pricks there, you feel it, you
Yes,
feel the
po.
needle, although it's tolerable, okay?
Yes.
Anyway, we also numb the region with our topical anesthesia. So it's also numb. And when you inject already the filler material, it has a lidocaine, so it will further numb the tissues there.
Yes.
And the good thing is the lips, it's already plump.
Yes, Doc.
It's
And
plump.
instant din yung medyo light na yung
The
dark color,
yeah,
Doc.
because we stretch the skin tissue, so it kind of brightened the color also.
Yes.
And the borders, they were defined, so there's a better contour, lip contour, and we restored the volume as well. And it will hydrate it will hydrate the lip tissues as well. So it's an instant result, it's
Yes,
tolerable, and it is safe, of course. And you can see the outcome with Miss M's right now. If you look at the profile view also, like you turn to the opposite side, the nose tip, the lip projection, chin projection, it's really balanced, it's good. It's within the harmony, the facial harmony there. And we have to hide the tissues under the chin, okay?
Yes.
So at this age, you can start doing prevention of the aging of the under chin so that it won't create the sagginess, the laxity, the bulge, or the dreaded one, the so-called turkey neck.
Yes.
Yeah. So everything is in proportions, ratios and proportions.
Yes.
Good angles,
Yes.
good projection, good convexity. I love the upper lip projected already.
Yes.
And the lower lip should be thicker than the upper lip, okay? Within the ratios and proportions. We follow some measurements there. So it's like a 0.6 to 1 ratio, or others are doing already the 50-50 ratio. So it will depend on the face look, if it's gonna give you that aesthetically pleasing appearance, right? So everything should be within the ratios and proportions. Thank you, Ems.
Thank you, Doc.
Right?
Thank you so much.
So we can see your transformation already. It's not
Yes,
the
Doc.
old Ems that I knew.
Yes.
Right?
Yes. Po.
When she started with us,
Yes,
she
Doc.
looks not the former Ems.
Yes po.
You're the Ems 2.0
0.0.
or 4.0 na?
4.0 na, Doc.
Yan. Okay. Upgrading, no?
Yes po.
There you go. So this is part of loving yourself, taking good
Yes.
care of yourself, boosting your confidence in a natural, non-surgical way.
Yes.
Thank you so much, folks. So we hope you had learned another, kind of treatment for these kinds of concerns, particularly the dark lips. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. We are located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. I think Ems had a previous episode 2 years ago.
A year ago.
Or a year ago.
Yes.
So you can check that at our YouTube channel, Contessa Salvador. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.